Two-thirds of all people diagnosed with cancer undergo radiation therapy. Every day, more than 100,000 of those people are treated on Varian products, and most of them have a lot of questions about radiation therapy. Simply put, radiotherapy, also known as radiation therapy, is a medical procedure to destroy cancer cells and shrink tumors. The radiation part actually refers to the type of high-energy X-rays used to treat the cancerous tumor. We'd like to introduce you to a breakthrough in radiotherapy, RapidArc from Varian. RapidArc is a radiotherapy technique that delivers a powerful dose of radiation in 3 dimensions, shaped like the tumor it's treating. So what that means is it focuses the treatment directly to the tumor, thereby helping to minimize the dose to the healthy surrounding tissue. But one of the most extraordinary things is it delivers the entire treatment in less than 2 minutes each day. A lot of people want to know what it's like to be in the room. They want to know who will treat them. What does the room look like? Will they be alone? To answer these questions, let's check out a treatment room, and I can take you through what someone may experience when they arrive at a cancer center or hospital for treatment. Of course, cancer treatment facilities can vary, and each patient's experience may be different. Let's begin by taking a look at the control room. You can see that the control room is filled with high-tech computer equipment and monitors. This is where the radiation therapist will be stationed when the treatment is being delivered. And of course, the therapist can see, hear, and talk to the patient if necessary. This machine is called the Trilogy, and it delivers the radiotherapy. RapidArc is a technique used on Trilogy to speed up the delivery of the radiotherapy to about 2 minutes. This is what we call the couch. It slides forward and back and moves up and down, depending upon where the treatment is to be delivered. Do you see these arms? They're actually Trilogy's eyes. These eyes, a system called OBI, or onboard imaging, will take images of the treatment area, sometimes by scanning a full rotation around the patient. These images are used to analyze the exact location and position of the pre-planned treatment. The therapist will move the couch based on this information to reproduce the exact position for treatment each day. Radiotherapy is typically an outpatient procedure, and the patient is awake. Depending on where the treatment is being delivered, the patient may be asked to change into a hospital gown. Sometimes loose-fitting street clothes will do. Then the patient will come into a treatment room like this and lay down on the couch. To help with the alignment and to be as precise as possible, a therapist may also place small marks on the skin. These marks are used to align the key position of treatment using a laser light. The eyes rotate around the patient to analyze the exact location, size, and 3-dimensional shape of the tumor. Each day, the process should be about the same. The patient walks into the room and lays down on the couch. The therapist dims the lights and aligns the patient with the lasers. The therapist sometimes turns on music, if it's available, and then walks out to the control area. Next, images with the OBI may be taken so that the therapist can fine-tune the positioning of the couch. After that, RapidArc goes to work and delivers the treatment in 1 revolution or rotation around the patient. That takes about 2 minutes. RapidArc treatment centers are becoming available all over. We recommend that you ask your doctor whether RapidArc radiotherapy is right for you. Your doctor and/or your oncologist will help you decide. Thanks for joining us.